Welcome to another vibrant health moment. Today, we're going to be talking about menopause from the point of view of us guys. Coming up. My wife is possibly already starting to get into menopause. I have no idea how to handle that. It's not happening yet, or is it happening? I don't know. What can you tell me?
All right, so first of all, I can tell you, Ernesto, that women are definitely more confusing than men. So you're in a safe
No
place
kidding.
right there. Yeah, no kidding, right? They're way more complex than us guys. So what happens is menopause happens usually between average 48 and 52 years old, but what's really confusing is the 10 to 15 years before menopause. So what's happening at menopause is that the ovaries stop making estrogen. And usually the bad time has happened already before that. But women can experience hot flashes, mood swings, irritability, low sex drive. They can start gaining weight for no reason. And so they can get really annoyed at themselves, which is why they might be a little bit grumpy to be around. That's really what's happening as they approach menopause. We call that the perimenopause area, and anything is possible during that time.
So, what can we as guys do to support her, knowing that she's going to go through this period?
Right. So guys, we have our own menopause. We call it andropause. And that's usually the loss of testosterone after about age 30. Guys lose it very slowly, but women can lose testosterone anywhere between the age of 20 and 40 at like 50% a year. So they feel the change. And it's usually tied to a couple of pregnancy cycles. So that's guys, when you got your lady and you see some changes happening, I want you to think this is what you need to know, that man, it could be hormonally related. There could be a hormonal imbalance going on. And the problem is that most women just go to their OB/GYN every year, they do a blood test and everything comes back normal. So they're even more confused because they're not feeling good in their body, but they never get any answers either from their family practice doctor or for their OB/GYN. And that doesn't make those doctors bad. They just don't know what they don't know. So at Get Well Scottsdale, we approach menopause and perimenopause and hormonal imbalance in a totally different way. We do extensive blood work. We check out your health history. We ask you a million questions. And so guys, what you want to know is you want to get your significant lady, your lover, to a place that actually does medicine differently than the general healthcare environment that we all find ourselves in.
And what is cool, it's just there in Arizona.
Well, there's places all around the country that are doing it right, but we happen to be one of those premier practices the way we do it. We've got decades of experience doing this. Most of the patients that come to us have really tried to go from doctor to doctor to doctor, and they just have not gotten symptom relief. Let's face it, look, what women are dealing with, they want to lose some weight. They want to feel good in their body. They don't want to have hot flashes and night sweats and things like that. They don't want to be moody and irritable and grumpy all the time. So to resolve those symptoms, you really need to get a healthcare provider that is an expert in this field. And at Get Well Scottsdale, we're at getwellscottsdale.com. You can check us out. We treat people from all over the country and very successfully, I might add. So, our objective is to the symptoms that your body is experiencing or your female counterpart, is experiencing. They just want to be happy in their body again. And that's what we deliver for those kind of patients.